Good afternoon. My name is Samit Shah, and I'm an interventional cardiologist at the Yale New Haven Health Heart and Vascular Center. I specialize in taking care of patients with coronary artery disease or plaque buildup in the blood vessels of the heart. One of the most common questions that patients ask is, how can I prevent a heart attack? Each year, more than 600,000 Americans will suffer a heart attack. These events can happen to people in the prime of their lives, and as cardiologists, we want to help patients do everything possible to try to reduce their risk. Joining me today are two of my colleagues who are experts in the area of preventative cardiology. Dr. Ehimen Aneni and Dr. Benjamin Gold are cardiologists with the Yale New Haven Health Heart and Vascular Center. I'd like to ask both of them some questions that are relevant to this question of how do we prevent heart attacks. Dr. Aneni, what should patients know about the role of cholesterol in heart disease?
Thank you for the introduction, Dr. Shah. Elevated levels of cholesterol, particularly low-density lipoprotein cholesterol, commonly referred to as LDL-C or just LDL, or sometimes we refer to them as the bad cholesterol, are associated with the development of heart disease. Persistent elevations in cholesterol leads to deposition of cholesterol in the walls of the arteries of the heart, and this is what we call cholesterol plaque. Over time, this leads to clogging and narrowing of these arteries, and they may lead to a heart attack. Therefore, it is critical that patients keep their cholesterol levels in check.
What are some ways that patients can lower their cholesterol, and what can they do to help keep things in check?
So the most important things patients can do to reduce their cholesterol and actually improve their heart health is to modify their lifestyle. This includes modifying one's diet, improving physical activity, and maintaining a healthy weight. I would really like to emphasize the role of diet in lowering cholesterol and promoting heart health. A heart-healthy diet is one that emphasizes the intake of fruits and vegetables, whole grain foods instead of processed grains, healthy protein sources such as fish and seafood, legumes and nuts, poultry and lean meat, and cooking with plant oils such as canola oil or soybean oil. Now, adjusting caloric intake coupled with at least 150 minutes of moderate physical activity per week will help maintain a healthy weight. It is crucial to quit smoking, and I can't emphasize this enough. Cigarette smoking accelerates the buildup of cholesterol deposits in the arteries of the heart. Cigarette smoking is a major cause of heart disease. Now, if these measures don't lower cholesterol adequately, patients may be offered cholesterol-lowering medication by their healthcare providers.
Thank you. That's all really important information. Are there any specific groups of people who are at particularly high risk for heart disease related to plaque buildup or cholesterol?
Yes. People with certain conditions that increase the risk of heart disease, such as diabetes, and those with a family history of early heart disease. And by that, we mean heart disease in a father or brother before the age of 55 years, or mother or sister before the age of 65 years. These individuals are at higher risk for heart disease related to cholesterol plaque buildup. People of South Asian ethnic ancestry also have a higher risk of heart disease compared to other ethnic groups. South Asians have higher rates of diabetes and abnormal glucose control. These groups will benefit from healthy lifestyle changes, just as we've discussed, and in specific instances, they may require cholesterol-lowering medication.
Thank you very much, Dr. Aneni. Another major risk factor for heart attacks is diabetes. Diabetes is a problem with the way that the body handles sugar. This includes sugar that people eat, as well as sugar that comes from the body's own energy stores. Undiagnosed or uncontrolled diabetes can lead to high levels of sugar in the blood that can damage blood vessels. I'd like to turn to Dr. Benjamin Gold to ask some questions specifically about diabetes. Dr. Gold, what impact does diabetes have on a person's risk of having a heart attack?
Thank you, Dr. Shah. It's a pleasure to be here, and thank you, Dr. Aneni, for that excellent little talk. The impact of diabetes on cardiovascular health is very significant, and I'm excited to talk to you about ways to mitigate your cardiovascular risk factors if you have diabetes. Patients with diabetes have a very high prevalence of coronary heart disease. And this is, as both Dr. Shah and Aneni had referred to, a blockage in the form of the coronary arteries. Those are the arteries that supply the heart with blood, in the form of plaques that build up in the wall of the inside of the blood vessels. So people with diabetes have a much higher rate of coronary heart disease. Now, in addition to that, they have a much higher rate and extent of ischemia. And ischemia is what we refer to as a lack of oxygen by the myocardial cells, by the heart tissue itself. So people with diabetes have a much greater extent of ischemia and damage to the heart from these plaque buildups. Now, in addition to that, people with diabetes are at a much higher risk for myocardial infarction. This is called a heart attack. People with diabetes can have platelets that are more active than most people and can have an increased risk of a sudden blockage of one of the coronary arteries, causing a heart attack. And diabetes also has a risk of causing something called silent ischemia. And this is specific to diabetes in that diabetes carries with it a risk of nerve damage. And you can have a situation where you could have a blockage in your heart, but because of the nerve damage and the attenuated body's response to sensing the pain, you might not be able to feel it, or you might feel something very reduced. And so it conceals this feeling of chest pain. And so people with diabetes are at special risk for this type of heart disease.
Thank you, Dr. Gold. That's really useful information. So are there certain populations that are at an increased risk of heart problems from diabetes?
Yes. So it's important to realize that, no matter across most ethnic populations, the risk of heart disease with diabetes is quite high. There's about a 7% risk for Caucasians. Although if you're of Asian descent, Hispanic, and especially African American, these are all populations and ethnicities that have a much higher rate of heart disease. People of African American and Hispanic ethnicity have about a 13% chance, or nearly double that of the population average with Caucasians. So it's very important if you're of these ethnicities to be screened for diabetes and to take it seriously if you know that you have it.
And if somebody is diagnosed with diabetes, what types of treatments are available?
It's a great question. We treat diabetes with a very broad and multifactorial approach. Now, Dr. Aneni had really specified a lot of these treatments, but I think they're important enough to go over again. We always start with diet for people with diabetes, and we emphasize vegetables, fresh fruits, nuts, whole grains, protein, particularly lean protein, and fish. And we try to avoid trans fats, red meat. The really important one here is highly processed or refined carbohydrates. That is basically anything you'll find in the middle of a supermarket that comes in a box or is baked. Cookies, cakes, breads. These are highly processed and carry a very high level of sugar in them. And then finally, sweetened beverages. So we try to avoid those. Weight reduction and having a normal BMI or body mass index is a very important aspect of maintaining cardiovascular health. Physical activity, and again, I'm going to repeat what Dr. Aneni said because it's so important. We really like patients to be exercising actively, either 2.5 hours a week of moderate intensity exercise, that would be like a brisk walk, or 75 minutes a week of vigorous intensity exercise, that would be going on a run.
Those are really helpful pointers, and I think our patients will really benefit from hearing that information. So that concludes our session today, and I would like to thank Dr. Aneni and Dr. Gold for providing so much information. We'd also like to thank the American Heart Association and Yale New Haven Health for the opportunity to discuss these important ways to help our patients reduce the risk of heart disease. Thank you.